you for inviting me to talk about fear of needles. I am an expert in this because I have fear of needles, believe it or not. I remember being a child and hating going to needles. And I developed, I'm not afraid of the needle itself, thanks God, because I do a lot of injection clinics. I inject patients all over their body for pain, but I am afraid of the pain that the needle can cause. And then I had to come up with a lot of strategies for myself. So then I can go through blood tests and a lot of interventions and procedures, including vaccines, and they work. So I can tell you that the strategies, they work. But it's interesting how this has been translated to my kids, because I think maybe my anxiety, they're not so anxious to pain and vaccines. They do well, much better than I did when I was a kid, but I am anxious for their pain. And believe it or not, I faint when I am in terrible acute pain, and I faint when my kids are in pain. So there is a total translation there. The psychiatrist in the group may explain what's going on. I don't know what it is. But if one of my kids, I can see anyone in pain, but if one of my kids or myself, we are in terrible pain, I faint. So I am an expert in the topic here. So I'll tell you about a lot of evidence-based resources that happen and that we can use, okay? So let me go to the next one. Okay, so in terms of disclosures, I have grants from some different agencies, but the only one that might be seen as a conflict is I have a monetized YouTube channel. So every time that someone clicks on my videos, I get a little bit of a few cents from the advertisement. But I have to say that I did a video about vaccine pain, and I'm donating all of the profits from that video to SCIP, Solutions for Kids in Pain. So in terms of potential conflicts, that's the only one that may be perceived in this talk. And this talk has been peer-reviewed by 3 people, including Alison Crawford and Sanjeev, who are not here today. So I hope at the end of this short talk, you will be able to remember 5 reasons why people do not get vaccines. Describe at least one strategy to help people to overcome trypanophobia, which is the academic name for fear of needles. And describe at least 3 strategies to reduce needle pain. There are many more, but I hope you remember 3 strategies to reduce needle pain. So it's interesting, the WHO, World Health Organization, in 2019, this is before the pandemic, published the 10 threats to global health, and one of them was vaccine hesitancy. And other ones were, of course, communicable disease, a global influenza pandemic. They were expecting one. But vaccine hesitancy is a big threat to global health. So we are in a rush to vaccinate billions of people in the globe. We are against the time. So we don't have a lot of research yet on why people don't want to get vaccines. So I brought to you some data regarding flu shots. And because we need about 70 to 80 people vaccinated for herd immunity. And why do people don't want to go to, for example, flu shots? The majority says they don't need it. A lot of people say, I didn't get around it. The vaccine itself, I don't know where they're offering this. I don't believe in vaccines. I dislike needles is one of the reasons. But we think that disliking needles might be an excuse, that might be a real symptom that sometimes other people use other excuses to hide that they are afraid of needle. Because it is okay for a kid to cry in the office and have a tantrum, but it's not okay for an adult to go to one of the vaccination centers and start crying and faint. So that is all the stigma and shame related to that. So they may avoid that situation for those reasons, right? So if you have to remember reasons why people don't get the vaccine, this is the slide that you have to remember. And other people say, well, my doctor didn't tell me, or in some countries, it costs money to get vaccine, not the COVID vaccine, but many other ones. So there are many reasons why people don't want to take vaccines. So what about trypanophobia, which is the fear of needles? Are we talking about fear of needle, just the needle itself, or the fear of pain? And sometimes they come together. Sometimes looking at the needle, the person will have the fear because they will remember past experiences that they felt pain and they don't want to experience that again. So the two come kind of together. But some people are just afraid of looking at a needle. That's why I will not have any needle in the slides here. You will not see any needle in my slides and in my video. I avoided putting needles because I was told, if you want to attract and educate people who have trypanophobia, don't show them a needle in slides. There are other ways of doing this. So it's interesting that it affects 2 in 3 children. So for those of you who are involved in vaccinating children, like regular vaccines that they have to take, a child below 2 years of age, they already got approximately, on average in Canada, 18 needles. So just from vaccines, it's a lot. It affects 1 in 3 adults in mild forms, but it's interesting that it affects 1 in 10. So it's 10% of adults have a severe fear of needle, severe. And in some cases, this is called a phobia, which is a psychiatric diagnosis. And Heather is here to tell us how she diagnoses a phobia. I'm not a psychiatrist, but it's a diagnosed mental health disorder, which has, to meet certain criteria. It causes extremely high anxiety and fear about needles, avoidance, and significant distress, impairments, and potential attempts to escape this. If they can escape, they can avoid, they will. The reaction is out of proportion, like fainting because of a needle. It's out of proportion. This doesn't make any sense. But anyways, I can't control if I am in too much pain. Most likely the person will get dizzy or faint during a needle procedure. So here it is, an article in the Globe and Mail that Terry, if you might remember Terry, the librarian, I asked her help and she sent me excellent resources that I put in my references at the end. So she sent me this article, which talks about 2 major strategies to overcome fear of needles. We're not talking about pain yet. This is just the fear of the needle and the fear of fainting because of the needle. So the first one, I think that's what worked with me, exposure therapy. But there is a way. I didn't go to a psychologist to do this exposure therapy. I actually thought that I was not able to go to medical school because when I was in high school, I was thinking about medical school and I tried to get exposed to procedures and needles. And so my parents, who are not physicians, they organized for me to go and see a C-section. I was in the high school and I went and guess what? I fainted and they had to rescue me and not to take care of the... So I said, maybe my dream of becoming a physician is dead. I will not be able to, but I decided I was going to be exposed. I didn't do psychology therapy, but I was reading books and talking to people that had the same thing. And I said, I will go to medical school. So I did, I finished. So this worked for me. And now I'm so glad because I can do injection therapy on everybody. But it's a type of cognitive behavioral therapy that the person will be exposed slowly. So then you have to see slowly from the least fearful, arranging them the least scary to the most scary, and then tackle each one and understand that just seeing a needle or seeing blood is not going to kill you. You're going to survive. So there is this therapy. And we heard that there are a lot of people who are not going to vaccines, right? Because of they made the appointment to vaccines. They booked the appointment. And in Montreal, this was a week in early April, 5,000 appointments were not fulfilled. And when I read that article, it says for many reasons why people didn't go: confusion about the appointment, they were confused where to go, the time, they didn't get a confirmation by email, etc., etc. But it was interesting that in that article on the CTV News, they were saying that impersonal mass vaccination centers are also among the barriers keeping some away. Having family physicians on the vaccination front line could help those who are afraid that a vaccine center won't address their concerns. So, what could be the concern? This is my concern. If I look at this picture and I say, I have to go to this place to get my vaccine, my first thing that comes to my mind is, if I faint, where is the stretcher? Am I going to faint in front of everybody? Am I going to just lie down there on the floor and everybody will be laughing at me and taking pictures and posting on social media? That's exactly what goes into my mind. Fortunately, I already had my 2 doses of COVID vaccine. And you know what I did to go to the COVID center? I distracted myself. I was super focused on taking selfies to post on social media that I didn't even notice when she did the needle on my arm, because I was taking selfies and doing a video. But that was a strategy that I used to distract myself. I was afraid of fainting. I didn't, so it went very well. By the way, the COVID vaccine doesn't hurt at all. The tetanus one is horrible. But this is what, so we need to understand, this is what goes into the mind of people that are hesitant. Sometimes they don't want to go there and faint and be, you know, embarrassed in front of people. This is another strategy for those of us who faint, and again, it's 1 in 10 adults. Muscle tension is very healthy, it's very effective. It's a technique that you can tense and relax the muscle, big muscle groups, like the abdomen and thighs, and you tense for 15 seconds until you feel that your face is flushed. And then you release the tension, not fully releasing everything. You can still keep some tension and then release again and then tense again. By doing this, you're keeping your arteries and veins contracted and full of blood and pumping blood to the brain. And you're also distracting yourself, like counting the seconds, how many seconds I'm doing this. And by the time that they stick the needle on you, you will not even notice. But this is a technique that is evidence-based and it works. And they talked about in this Globe and Mail article. I'm so happy that they did that. So let's now talk about pain management strategies, and I'll talk about children and adults, okay? Well, a lot of people say, well, it's not important to talk about pain in the vaccines because it's not a priority, it's just a poke, it only lasts a few minutes. Why we're talking about pain management in a shot that only lasts a few seconds? Well, there are consequences. So it is important when we are vaccinating children to manage their pain, because there is a long-lasting negative childhood immunization experience, especially between 4 and 6 years of age, may be associated with fear and non-compliance of vaccination throughout adulthood. And we don't want to cause that, right? We want our kids to have a good experience, good memories, so when they become adults, they will not be hesitant to take their vaccines. But not only this, it's also important to manage pain in adults, because if you don't do this, there is a big correlation between people who are afraid of pain from needles. They avoid seeing the doctors, they avoid blood tests, they avoid getting vaccines, and they even avoid surgical procedures that are essential for their health. And they also pass that anxiety to their children. The children learn the anxiety from needles from their parents. So we need to make sure that if there is a strategy to reduce pain during vaccination, we are using it. Does it cost a lot of money? No, these are low-cost interventions. I'll show you what they are. So once you address the fear of the needle with the exposure technique and with the muscle tension technique for them not to faint, then you can start addressing the pain. There are many strategies. They are evidence-based, a lot of studies done. Many are cost-free. They don't cost anything or just peanuts. Easily available, quick. They do not add a lot of time to your appointment. And actually, who doesn't like to have a nice appointment? Like if you're a pediatrician or a family doctor, and every time you have to give vaccines, you have that baby screaming in your office and the mom or dad crying. It's a terrible experience for everybody, even for those who are in the waiting room. So who doesn't like to have a peaceful vaccination, right? Everybody. And so let's learn about some of these techniques here today. Actually, there is a guideline by Anna Tadio. Anna Tadio is from the Department of Pharmacy at the University of Toronto, and she led this big endeavor that was published, this guideline in 2015. Actually, this was an updated guideline she had published before, and the previous guideline was only vaccination for children, and now this version in 2015, they included evidence-based interventions for adults as well. So there are 5 types of interventions, 5 Ps: procedural, physical, pharmacological, process, and psychological. And then they split between strong and weak recommendations. So let's talk first about the strong recommendations. There are 2 in the guideline that work across all age groups: babies, infants, children, adolescents, and adults. What are they? So first of all, do not do aspiration. So there's no need to be, pulling the plug of the syringe. There's no need to do that because the areas that we inject vaccines, deltoid and thighs, they don't have big arteries or veins that can, you'll be injecting in the wrong place. So like pulling back is just a waste of time. And what happens if you get a little bit of blood? Then you have to do another needle and be poking. This just increases the time of the procedure. It's not recommended. There is no way you can inject in any blood vessel and increase the pain. So don't do it. Just poof, inject and remove it. So that's the first evidence-based strong recommendation in the guideline. So there is, I copied this from the guideline, that in many countries, there are also the syringes that they use that do not allow you to do aspiration. And there has been no problem, and it's a very cost-free and intervention for pain mitigation. The other one is the order of the injections. So especially for babies who go for appointments and they have to have multiple injections, there is a recommendation to start with the one that doesn't hurt more, the least painful injection to the most painful, because there is a memory from the first to the last, and then you're sensitizing the pain system more and more if you do the most painful first. So in babies, they say that the MMR2 and Prevnar should be given last because they are the most painful ones. Okay. So those were the 2 most evidence-based and strong recommendations. We have other ones. These are still strong recommendations, but now we are going to have some recommendations that are useful for babies and children, but not for adults. So look at this table here. Physical interventions. What about breastfeeding? It is advisable to ask the mom to breastfeed, remove the clothes of the baby, and then use the thigh to do the vaccine, because then the baby will be much in less pain and it will also be comfortable for the mother. And it's a good position because the baby will be in the mother's lap. The other one is positioning. Skin contact is excellent. It's possible for babies and children to have them in the mother's or the parents' laps, because that provides some comfort instead of having them lying on the table. That it gives the baby, the child, a loss of control. They don't know what's going to happen. You have to hold them, and you have to have like 4 people holding them. Instead, if you just keep them in the parents' laps, and it's much more comfortable, they don't need to look at the needle. There's also some evidence I didn't bring here because I couldn't find pictures, but if there is another person like a nurse or an older brother or sister that could be blowing bubbles, soap bubbles for the child to look at. So when they're looking at the bubbles, they will be distracted. There's a lot of distraction technique that we'll talk about, but these days, almost, it's easy to find a smartphone with a game, with a movie, with a music, and just having the kid, even 6 months old, they watch, movies and things on the iPhones these days. Having them to watch those things and listening to the music, they will be distracted and they will not even notice that you gave them the needle. They might, they might avoid a little bit, make some faces, cry a little bit, but it will not be the whole experience. Because remember, the needle lasts 1 second, but the memory lasts a lifetime. So what we're trying to avoid here is the memory of the procedure. The pain is fast. For older kids, we also recommend, you see here, adults not so much, but for older kids, it's also recommended to use some topical anesthetic, just to give them some sense that something is being done. Like you could put an amla patch or even apply some topical cream of lidocaine 1 hour before. This requires a little bit of more preparation because they have to buy the cream and apply and wait and sit for a couple of minutes. But if possible, it gives the child a sense that someone is doing something for the pain. Don't lie to the child, especially if you're a parent. There is recommendation, evidence-based recommendation saying, if you tell the child, oh, it's not going to hurt, or tell them, we're going to the doctor, but they will not give you the injection, and then they go there and they get the injection, it's terrible, because they will lose the trust in you as a parent and also in the doctor. So tell them what is going to happen and what you're trying to do, what you're doing to try to avoid the painful procedure. That gives the kid and the adolescent, the teenager, or the small kid to some sense of power that they're doing something to avoid the pain. Sweet tasting solutions, also very helpful. And here it is. So they recommend sucrose or glucose, like put in a syringe, 2 cc's of some glucose substance. And just a few seconds before the needle goes in, just to start putting that sucrose substance in their mouth, especially for babies. They will be, ingesting that, and they will not. There is even some evidence that the glucose or sucrose will inhibit the pain in the brain, so they will pay less attention. I think it's more like something that is just tasting good in the mouth that they will be paying attention to. They will not pay too much attention to the needle, what's going on in their arm, because they're getting something much more pleasant. This is if the parent cannot breastfeed. So that's what you use, sucrose or glucose. And here, I'm not going to read this table for you, but in the guideline, there are a lot of weak recommendations and some that are recommendations against. So I highlighted here some things against. So they suggest, for example, don't try manual tactile stimulation or warming up the vaccine or vapocoolants or acetaminophen, ibuprofen before the needle, doesn't make any difference. And you don't need to do breastfeeding and glucose sucrose at the same time. Breastfeeding is the best, but you don't need to do both at the same time. And in terms of psychological interventions, there's a lot of things here that they suggest. I'll leave the slides with you and the link to the guideline, but they also suggest against music distraction, like playing music, loud music, because the kid may start dancing. I caused one pneumothorax in one of my patients. I was injecting the rhomboids many years ago, and she was afraid of needles. I put a video with a room, I can't remember what kind of music was it, and she was dancing, and I caused pneumothorax. There is evidence against some type of breathing distractions. Breathing is good distraction, but you have to be careful with if they're starting to move too much, because you don't want them to move. You want them to be quiet and holding the same position. So I did this video in collaboration with SKIP, Solutions for Kids in Pain, where I summarize all of these interventions in, I think the video is about 10 minutes, and people can watch and see what are these evidence-based interventions. So I hope you will remember 5 reasons why people avoid vaccines, at least one strategy for people who have fear of the needle itself, and at least 3 strategies for the pain of the needles. Here are the references that I used, and I think we're open for discussion, and tell me what worked for you. The guideline that I mentioned is the last one here in this resource page.